Welcome to our first session in our series of webinars developed for people with newly diagnosed celiac disease. This session will focus on what is celiac disease. Talking you through this series will be our presenter, Leah Seamark, who's a specialist gastroenterology dietitian working for Somerset Partnership NHS Foundation Trust. She will be joined by a panel of NHS specialists who will be asked various questions throughout the series. I will now hand over to Leah, who will discuss what is celiac disease.
So celiac disease is a lifelong autoimmune condition. So when we say lifelong, it means that once you're diagnosed with it, it's something you will have for life. It's not a condition you will grow out of. And it's an autoimmune condition. So that means when the immune system, which is the body's defense against infection, mistakenly starts to damage some of the healthy tissues within the body. And in celiac disease, that damage occurs within the gut. And I'll talk a little bit more about the specifics of that in a moment. And in celiac disease, that abnormal immune response is caused by a reaction to gluten, which is a protein found in grains including wheat, barley and rye. In terms of how common it is, 1 in 100 people have the condition, but it's believed that about only 24% of people with celiac disease actually have that diagnosis. So there's a potential, there's lots of people out there with celiac disease who don't yet know it. There are a few groups of people who are at high risk of having celiac disease. So if you have a first degree relative with celiac disease, there's a 1 in 10 chance of having the condition as well. A couple of the other higher risk groups include other autoimmune conditions, including type 1 diabetes and the autoimmune thyroid disease. And a couple of genetic conditions where celiac disease is shown to be more common include Turner syndrome and Down syndrome. So I mentioned before that celiac disease specifically affects the gut. And the part of the gut that it affects is the small intestine. Now, the small intestine is the part of the gut where all the nutrients from the foods that you eat are absorbed. And to help that process, the lining of the small intestine has lots and lots of these finger-like projections called villi. So if we were to look at this slide here, the picture in the top circle shows a close-up of a healthy lining of the small intestine. So as you can see, there's lots and lots of those finger-like projections, which we call villi. And those villi actually help increase the surface area available for the absorption of nutrients. Now, if we were to look at the lining of someone with celiac disease, that picture would look very different. So if we were to look at the picture in the circle at the bottom, that shows a close-up of the lining of someone with celiac disease who's eating gluten. So when someone with celiac disease eats gluten, that immune response is activated and that causes damage to that lining. So those finger-like projections become flattened. That therefore reduces the surface area available for absorption of the nutrients, which can lead to a range of symptoms, including indigestion, diarrhea, constipation, vomiting, stomach cramps, and bloating. So these are some of the traditional gut symptoms that people with celiac disease may present with. But we now know there's a range of symptoms that people with celiac disease may present with. That includes osteoporosis, so fragile brittle bones, which can be caused by poor absorption of calcium, tooth enamel defects, low vitamin B12 or folate levels, low iron levels, fatigue, problems that affect growth and puberty, which can be seen in children who would have the diagnosis, the skin rash, so specifically dermatitis herpetiformis, and that's the skin manifestation of celiac disease. And it's characterised by sort of raised red patches and blisters. And people who have dermatitis herpetiformis may not present with gut symptoms, but they often still have the damage to the lining of the gut. Other symptoms may include persistent mouth ulcers, abnormal liver function, fertility problems, and we're increasingly becoming aware of some of the neurological symptoms associated with celiac disease. So this may include peripheral neuropathy, which is sort of numbness and tingling in the hands and feet, and ataxia, which is an umbrella term for various neurological symptoms, including sort of poor balance, poor coordination, loss of balance. So there's a range of symptoms there which people may present with.
Do patients with celiac disease always present with gut symptoms?
So the answer is no, they don't. Celiac disease used to be thought of as a disease which was picked up in children who developed diarrhea, weight loss, and often failure to grow. But these days, we're often seeing much more vague symptoms. So people might have a few irritable bowel syndrome type symptoms. They may have no symptoms at all and actually be picked up incidentally because they're found to be anemic and they have the investigation to go ahead and biopsy their small bowel, which is one of the things we do when people have undiagnosed anemia. Exactly as Leah has already said, there are a whole range of symptoms people can get with celiac disease, and often it takes being open-minded to think about doing the right blood test or to do a biopsy if we happen to be doing an endoscopy anyway.
Thank you to Dr. Emma Gregg for answering that question. Really helpful. And thank you to you for watching this webinar. We really hope that you found it useful. Please don't forget that we've developed a series of webinars about celiac disease with our NHS specialist team, and you may now wish to watch the next one in the series, which discusses the process for diagnosing celiac disease.